Welcome to this AJR Insider video. I'm Andy Rosenkrantz, Editor-in-Chief of AJR, and I'm here today with Dr. Ann Covey from Memorial Sloan Kettering Cancer Center, who is editor of our Interventional Radiology section. In this video, she'll be sharing with us her insights about the section. Ann, thanks for being here.
Thanks for having me, Andy.
Can you tell us about your background in IR?
Sure. So I trained at Yale New Haven Hospital. I did both my residency and fellowship there, and at the time it actually was a fellowship. My current position at Memorial Sloan Kettering is actually the first position I took after training. I did leave for 1 year, and I spent a year at Indiana University, which was actually a terrific experience, but ultimately highlighted for me that New York was my home. I work at a cancer center, obviously, Memorial Sloan Kettering. So most of my work is in interventional oncology, and within interventional oncology, I sort of further specialize in hepatobiliary interventions.
Thank you for sharing that. Let's move on now to the IR section. What trends have you observed for recent AJR submissions in the area?
Yeah, it's been very interesting to see how things have evolved over the last 4 years. I started this role as did you, during COVID. And I think under your leadership, we've really made a concerted effort to be highly clinically impactful and relevant for our readership, focusing on common diseases or common clinical scenarios with novel and actionable data. And I think as this message has gotten out, we've been very successful in sort of guiding authors along those lines. Early on, we were seeing a lot of sort of single-arm retrospective studies, some on very interesting and some on more esoteric topics. But now that, the word's getting out, I think we're getting sort of more rigorous studies with sophisticated statistical analyses, propensity score matching, for example, in some of these larger retrospective studies. And it's been interesting and satisfying to see.
And what do you see as areas of interest for publishing in IR over the coming year?
So I think we're looking for highly impactful studies on common diseases. We want and expect and think AJR, is really the go-to journal for clinical radiologists. We know that most of our readership is in private practice, and ultimately, I want to publish articles that the reader can pick up and read, and if appropriate to their practice, really integrate, with minimal barriers. I think it's important to know that we don't have a specific agenda or favorite topics. We're really looking for clinical relevance and novelty.
So it's helpful to hear of these priorities for what we publish. What tips do you have for authors looking to publish specifically in IR?
So once you have your hypothesis, I think it's a good idea to do a quick literature search and see whether or not it's novel. We're looking in AJR to publish things that are, haven't been published 3 or 4 or 5 times before. I would say as the rigor of studies published in IR gets higher and better, it's probably a good idea to involve a statistician early. Most of our studies are still retrospective, although we very much want and are moving towards having more prospective or including more prospective studies. But some of these retrospective studies, we know have risks of bias and confounding factors. And if you involve a statistician early, they can help both with the study design, make sure you have appropriate numbers, and that the study is valid.
Any common pitfalls that you're seeing in submissions that we should highlight?
Yeah, I think one of the very common things is in that first step, defining the study population. We want to know how patients were identified. Was it from PACS, or was it from the medical record, or did somebody keep a prospective database? We very much want specific inclusion and exclusion criteria. We've all but mandated, inclusion of a figure 1 flow chart to sort of guide the reader to understand the inclusion and exclusion criteria. And I think that's a really good exercise too for the author to make sure they are very clear about the patient population. And sometimes that's not included in the first submission. Sometimes the clinical question or purpose of the study is not very defined. And I think, that needs to be clear in the manuscript. Another common issue that we see is sometimes authors including results in the discussion session that weren't included in the actual results section. I think those are the biggies that I can think of.
And anything else that you'd like for our listeners to know?
I think I'd like the listeners to know that we and the editorial board really take each of these submissions very seriously. We know how much time and effort goes into preparing a manuscript because we've all done it. So no decision that we make is taken lightly. We've streamlined the process, under your leadership, so that authors will almost always get feedback from the initial submission within 3 weeks, which I think is pretty remarkable. I'd also say that while some topics lend themselves well to, strong clinically oriented original research, we have other options for publishing as well. I would encourage authors to take a look at the AJR author guidelines page. Some of the submission types like the practice pearl and the clinical perspective really lend themselves well to interventional radiology specifically.
I really would need to credit our staff and the rest of our team with implementing many of these changes over the past years. And thanks again for being here, and I really enjoyed speaking with you.
Andy, it's always a pleasure, and thank you for this opportunity.